We are honored to introduce our keynote speaker, Ms. Dr. G.K. Tara Jayasri. Tara Jayasri has been graduated from Coimbatore in Ayurveda College in 2003. She has done her Bachelor of Ayurvedic Medicine and Surgery from Tamil Nadu from Dr. MGR Medical University at Chennai. As the first Ayurveda physician in her family, she further enhanced her expertise with a master's degree from KVG Ayurveda College in Sulia in Karnataka. Her professional journey includes 19 years of clinical practice at Ayurveda Chikitsalayam and Research Institute at Coimbatore under mentorship of Dr. K.G. Ravindran. She has also been supported by late Padma Shri P.R. Krishnakumarji, the Managing Director of Ayurveda Pharmacy, founder of AVP Research Foundation. Ms. Tara's contribution have been advancing the practice and global recognition of Ayurveda. So today, please join me in welcoming Vaidya Ji.
Thank you, Radhika, for the introduction. I wholeheartedly thank Srivani ma'am and the Vishwa team, especially Radhika, Navina, Prerna has
Ma'am, your video is not visible. Can you tilt your laptop? Yes, yes.
I personally
a little more, ma'am. A little more. It's getting done.
Is that okay?
A little more. Can you add some?
Yeah.
Yes, ma'am.
So I would like to thank Srivani ma'am and the whole team, especially Radhika, Prerna, Navina for being so humble and polite in making it organized. Actually, they have been in touch in a very periodical way to get all the things organized. So without further delay, I'd like to go to the session. So today's topic of discussion would be pediatric care in Ayurveda. So we all know Ayurveda is a science of life, and there are various specialities in Ayurveda. So today I am just going to highlight few remedies for the pediatric care, especially dealing with the children illness, which most of the parents will be facing. So I have tried to discuss a few therapies which you can make at home, or you can try at home in a very easy way for a precautionary and preventive aspect for various type of the child disorder or children illness. So I'd like to start sharing the slide with you. So,
yes, ma'am, we can see your screen.
Yeah. We have different specialities in Ayurveda. So, in that, Kaumara Bhrityam or Bala Roga Vijnanam is the special branch which deals only with the children disorder. So, our acharyas, even though they have, it is an science which is even ancient with a period of more than 5,000 years. We have long-sighted acharyas who have been who have been actually, yeah, ma'am. Is there any interruption?
No, ma'am. We are sharing the screen from our side. Is
Okay.
it okay? Yeah.
I think the second screen. Yeah. So this is like basically the Kaumara Bhrityam or the Balaroga Vijnanam has been already discussed according to Ayurveda Acharyas, and it is special science which works around the disease of the children and their treatment. So it basically deals with the importance of the physical, mental and psychological growth of the child also. So that is what we really look for, the physical, mental and psychological growth of the children. Why I am trying to insist this is physical growth and mental growth. Nowadays, after COVID, especially after the homeschooling, many children are physically underdeveloped because of various ailments like non-exposure to sun, and a lot of eye problems, and even mentally, like they are more addicted to the mobile phone, and due to that there is an hindrance of the psychological growth of the child also. Next slide. So actually the Kaumara Bhrityam does not start only after the birth of the child. It just starts from the pregnancy. So right from the day one of the conception, according to Ayurveda, we have different medications which we can give for the mother also. So according to our science, the mind of the fetus starts being expressed in the 5th month of the pregnancy, and the intellect starts from the 6th month of the pregnancy. So actually, the pregnant mother should always adhere to a very sattvic diet. That is why we always insist in giving non-spicy or non-oily food for a pregnant mother, because even a spice or an oily food can affect the fetus in the womb. So from the 6th month onwards, it is eligible, it is advised, the pregnant mother is advised to add lot of medicinal herbs which can stimulate the brain growth of the child, especially like Brahmi, Mandukaparni, Shankapushpi. We have different formulations in Ayurveda, including which includes the Brahmi, Mandukaparni and Shankapushpi tonics, which helps in improving the brain development or the mental status of the children, even though it is inside the womb of the pregnant mother. Next slide. So, like many of our common question is, what kind of diet should be given to a child? So basically, we all know it should be a balanced diet. It should be an equal combination of everything, equal carbohydrate, protein, fat, vitamins, whatever it may be. And it should be like focused on the natural light, heating, and dryness. Especially, we have to be more concentrating on the fibers intake of the child, and let it be a whole grain. Like don't dehusk. For example, when we just take wheat, most of them give the dehusked wheat. But when it is taken as a whole grain, that adds more fiber to that. So make sure that you give the whole grain, not in any transformed form of the that particular cereal. And digestive spices such as garlic, ginger, cinnamon, and turmeric can be incorporated right from very early childhood ages also, because these acts like a very good digestive and carminative. Because in our OPD, many of parents' common complaint is, my child is not eating well, my child is not putting on weight. But in that case, when we start adding little ginger, cinnamon, and turmeric to their food on a regular basis, that can definitely help to improve their immunity and helps as an anti-inflammatory, and equally it helps to improve their absorption, not only the digestion but absorption, a good absorption of the food, what the each and every parent looks for. Next slide. So, and many of the parents' common complaint, they are not putting on weight, they feel very tired, and they are not mingling well with the their friends and all. So in that case, you can start oil massages for the children. Actually, this oil massage can be done from the very next day of the childbirth. Initial stages, we just use some pure coconut oil, because the skin will be very sensitive when it is in the womb, and when it just sees to the external environment, the skin takes some time to get adapted to the external heat and the cold. So the child, the baby's skin will be very sensitive. Just to start with, you can start some oil application with plain coconut oil, or even with the malai, that is the pal adai we used to say, the cream of the milk. Maybe for a week you can try and just leave it for 10 to 15 minutes and give lukewarm bath. Because oil massages can calm the nervous system, because the child has to get adapted to the external environment. And equally, this oil massage can lubricate and rejuvenates the tissue. It can promote the healthy circulation throughout. And in Ayurveda, we use some of the common oil which we use for our children, especially the newborn baby. The names are like Bala Ashwagandhadi Tailam, Lakshadi Tailam, and Bala Tailam. It is made up of a simple drug called Bala, which is Sida cardifolia, and it is very good for the bone growth, especially the child, the born child. The skin and also the bone health is very important. So in such cases, these three oils are very safe to use in a newborn kid. Next slide. So we have heard about many families following certain rituals like samskaras. I'm sure many of our children have undergone sanskaras. I have just tried to make an attempt to know what is the importance of the sanskaras, what we do for our children. So sanskaras are nothing but the rituals what we do for a newborn child. Like you might have attended lot of ear piercing functions, like head shaving, hair shaving functions and all. So why do we do it for the children? Number one, it plays a prime role in child health system and overall development in each milestone of the child. And it can be a preventive aspect of many diseases, and it helps to adopt the child's mental health and the physical health to the environment. And number four, it gives an individual identity to the child, and it equally educates the child also. So for these noted 5 sanskaras, we have special sanskaras, which I am just trying to explain in the next slides. Next slide. So the first one is Jata Karma Sanskara, that is like which is performed immediately after the birth. So it is explained in Ayurveda that as soon as the child is born, we have to before we feed the breast milk, it is necessary that you keep the mixture of the grita and madhu, but not in a equal proportion. Both has to be in an unequal proportion. And if you can have a piece of gold just dipped into that, and you make 1 drop of this combination to lick in the tongue of the newborn baby, it is meant to be very acting as a medya, ayushkara and pushtikara for the child. Because ghee and honey is equal quantity may stimulate the immune system of the child, and which is just going to happen immediately after birth. So this is like a very good combination, and there are a lot of children who have been very intellectual, those who have undergone these samskaras. So especially the combination of this grita madhu, that is ghee, honey, which is just dipped in a piece of gold, is considered to be improving the memory of the child. Next slide. The next sanskara is Namakarna Sanskara, the naming ceremony. So why do we name the child? Why do we invite the whole family or many family to this naming ceremony? Number one, it develops the parental bonding with the baby and understanding the parental responsibilities. So when we chant this name of the baby in the ear, it's an indication of the parental responsibility. And in this day, we bath the mother and the baby with some medicated water. So again, it ensures the hygiene and the disinfection also. So this is like the basic importance of the Namakarna Sanskara. Next slide. And then we do Nishkrama Sanskara. This is basically the child is taken out from the home for the very first time. Maybe in an 60 days or maybe after a month like this. So this So what does this Nishkrama Sanskara does? It empowers the baby to adapt to the external environment, because so far it has been in a very cold and very disinfective environment, that is like inside the house. But when we take the baby out from our home, this sanskara helps to empower the baby to get adopted to the external environment. And the places preferred is temple, where they can hear the Shankanada or chanting of the Vedic mantras. So that is very serene, and the child can be much more in a very good way, brought up in a good way. So the preferred place is first to the temple. Next slide. And then Annaprashna Sanskara. So like in the 6th month of your baby, you might have given for the first food in a temple or anything like that. So after like maybe the weaning of the breast milk, or when we try to incorporate solid food for the baby, this Annaprashna Sanskara happens. So it is mainly done during the 6th month, which is mainly done to supplement the baby's food with the fruit, which is rich in vitamin C, because that is very important for the immune development of the immune system, so that they get adopted to the solid food also. Next slide. Karnavedana Sanskara. Usually it happens in different number of days. Some people does it on the 11th day. Some people does it after a year, like that. But the importance of this is, when there is a local inflammation happening after the piercing of the ear, that may act as a buffering mechanism for the stimulation of the body's immune system. That is the reason we do the piercing of the ear. So now it has become a fashion. Even adults do it after a long time. But when we pierce the ear in the childhood, it has to be there, because it is one way it is going to be an stimulation of our body's immune system also. Next slide. And this is like shaving of the hair, especially this is called Chuda Karma Sanskara. This is done to examine if there is any deformity or any wound on the skull, and it can equally stimulate the hair growth also. Earlier days, it was just done to detect the abnormalities like wide sutures, because in cases of a forceps delivery, or like some complications during the delivery and all, like this microcephaly, macrocephaly, and a depressed fontanelle and all, this when we shave the hair of the baby, we can easily detect. So this was done during the earlier days also. Next slide. Vedaramba Samskara. So Vidyarambam, we used to say, that is like writing, making the habit to start the letters like Harishri Ganapatiye Namaha in the with a piece of the turmeric in a plate of a rice. So this is either turmeric or the gold. This is where we are educating this. So these many sanskaras has to be done during the milestones of the each and every child. Next slide. And Upanayana Sanskara. This is like it signifies the spiritual rebirth. So the young boy become a Dvija, that is, he is twice born. And even the brain growth of the child gets completed during the 5th age. So during like between that, the Upanayana Sanskara has to be done, so that they have a good memory to chant the mantras. And also that the thread which is tied around the waist, now actually it can be a denotion mark for their physical growth. And it can rule out the malnutrition also. Yeah, next slide. So this Swarna Prashnam. So this is like, I think someone has texted me about the Swarna Prashnam. Swarna Prashnam is done during the Kshiranada stage, that is the childhood stage, which develops the brain, and it which can act as a Medya Rasayana, which can help to improve their memory, and can equally act as an immune, it can help to improve their immunity and helps as a body's defense mechanism also. In this, we have the Swarna Bindu, a combination of certain Medya drugs with honey and grita, where we instill few drops to every child till the age of 16 in the Puya Nakshatram, Pushya Nakshatram. So this is specially done in this nakshatra. Among all the Ayurvedic centers, we nowadays follow it very religiously. Next slide. So what do basically the infant or face in different stages of their life? Number one, the infancy is mainly the nurturing this seedling actually. So what are the common ailments what we face during the infancy? Number one, skin radiance, and many of the number two is the immunity, because that has been a common complaint nowadays from all the parents. And we have to do abhyangam and maintain the body temperature and equally nourish the scalp and the body. And equally they face some of the digestive issues like colic pain, constipation, and also the gases. Next slide. And in early childhood, they usually face respiratory issues. So in that cases, you can give honey daily, on a daily basis, especially the spiced honey with ginger, tulasi and all. Try to incorporate ginger in most of their food. Tulasi arka, that is a medicated preparations where that is an distillation, during like a distillation process, we extract the essence of the tulasi and even the karpuravalli, ajwain leaves. So these distilled liquid can be given to improve their respiratory health also, and obviously make them to undergo the Swarna Prashanam also on every Pushya Nakshatra, because that can help to improve the immunity also. So early childhood, what do they face? Commonly, and eating habits, because the eating habits are very poor, and they equally have sleep issues and behavioral patterns of the children also. And during the adolescence, their behaviors and hormonal issues also add on to their problem. Next slide. So number one, the main medicine to be discussed, what I'm just planning to discuss is Chavana Prasham. It is a very rich and nutrient jam, just made up of amlaki or nellikai. It can help the child to improve the immunity and the physiological growth of the child, because it is rich in vitamin C and it can help as a defense mechanism. So try to start this Chavana Prasham right away. Either you can have it at bedtime or equally after breakfast also, followed by a glass of warm milk. So that can equally help and nourish your immune system of your child. Next slide. Spiced honey. So you can spice your honey with little pinch of black pepper, cinnamon, cardamom, ginger or turmeric. Trikatu. Trikatu is a combination of pepper and long pepper and these things. So these you can have it along with the honey, because this can help to improve their digestion and it can help to improve all the kapha doshas also. Next slide. So especially when a child has an ear infection, many of us has just heard from our child that there is a block in the ear, or there is a pain or an inflammation around the ear. So in that cases, you can just crush a little bit of garlic, slightly warm it up with oil. Just to take the essence out of the garlic, and you can warm and just check the temperature in your palmar skin, and then you can put 1 or 2 drops of this garlic oil in the ear. Or you can keep hot and cold pad alternatively. Just watch out the sleeping posture. And number 4, like you can equally apply some ginger juice around their ears, because in case of any accumulation of the cold or kapha, that area will be inflamed. If there is any water retention, you can apply a little bit of ginger paste or ginger juice around the ear. Mustard oil is equally effective for the wax removal. So in case if it is very much dry or anything like that, you can just put 1 or 2 drops of mustard oil also. You can equally try olive oil. And in case of ear pain or any ear infection, you can just fry little bit of horse gram, powder it, add it with honey, slightly filter it, and you can use that combination as an ear drop that can help to improve your ear infection. Next slide. And childhood obesity. So nowadays, after COVID, many children have started gaining weight, and they are finding it very difficult to shred their weight. In that cases, you can add shunti, that is the ginger, and there is a drug called vidanga, that is emplica rice, even the vacha, that vasambu, you can try to incorporate more in your child's food. and make sure they have more of green leafy vegetable. Honey and lemon juice can be given on a very regular basis. And mint as of we know, it helps like a digestive, and it's a very good agent to improve the flavor of the food, but it equally helps in the weight loss also, and it can enhance the taste bud of the child. So try to have some mint supplement or mint juice on a daily basis. Next slide. And try to balance your meal and always favor warm food. Don't give them refrigerated or cold food or reheated food, and limit the sugar and the processed food, because instead sugar you can try to add jaggery and try to avoid all the type of the processed food, and keep more of a herbal supplement, because that is safe and without any side effect, and make them to do some regular exercise. If they are, you start walking with them or cycling with them, and ensure an adequate sleep for the child, and limit the screen timing. That is very common advice of the parent, but children don't listen, but try to divert their attention to some other thing. And Ayurvedic detox. So right from the age of like maybe 2 or 3, you can start some detoxification program. Ensure that they take a stomach wash on every 3 months or 6 months. If they are a very person of who depends on outside food for a longer timing, you can give purgation once in 2 to 3 months, a stomach wash also. Next slide. So you may also come across lot of skin conditions like itching or any urticaria, like a mosquito bite, allergic to the mosquito bite and all. In that condition, very simple remedy is durva, the Bermuda grass. So you can extract the juice out of that and you can apply, which is a very good remedy for any type of itching. And we have a drug or herb called Harita Manjari, that is Kupaimeni, that is what we call it in Tamil. That's again very good for all type of skin lesions. And Paranti, Techipu, that is equally effective. And neem, turmeric, and oatmeal. Again, oatmeal bran is a very good agent to improve the skin condition. Even for the bath, giving bath for the children, you can grind this oatmeal and it helps as a very good scrubbing agent for the children's skin. It's a very smooth and very safe thing to use oatmeal for the as a scrub also. Next slide. And in case of any boils, sometimes they unknowingly get any boil or a psoriatic lesion or even a fungal infection, you can grind some mehendi leaves and apply over that area. And Shanka Pushpi, that is like the Sangupu, the flowers and the root of that equally helps in the fungal infection and even certain scabies conditions also. Saffron stigmas, that is Kungumapu, that is very good for the acne and even any boils in the face also. And oatmeal, as I have discussed earlier. Cabbage leaves, when the child has a very dry skin lesion like for psoriasis and all, you can apply cabbage leaves also as an external application. Next slide. So again, this is a very common condition which many children come across. So in that case, like a seasonal flu, always don't wait until they get the fever. Make sure that once in 15 days, they get the juice of this ajwain leaf, small onions, betel leaves and palm candy. Just mix it, make it less spicy and just give maybe 15 to 20 ml on once in fortnight basis. You can equally give us tulsi juice and ginger juice, even amla, pepper and harad juice, but everything helps in the initial stages only. Once when the fever is more than 101 degree, this may be helping as a precautionary agent, but not as a curative agent. Next slide. So many of our children, maybe they are lazy to go to the school or anything, they complain of stomach pain and all. But if there is any real complaint or if you find any heavy bloatedness in your child's stomach, you can always keep cumin and dry ginger ready. Just make some decoction out of that and you can make them to add a little honey and you can give them that way. Immediately relieves the gastrointestinal pain and all. You can also try banana with honey and cardamom water. So if they are very particular with the taste and all, you can just infuse this cardamom with water, and you can just make them to drink. And of course, coconut water, but with kernels. That is a very good remedy for all type of stomach issues, especially when it is too heaty. This will help you. And draksha, that is the black grapes, you can soak it overnight. Just to smash it with little jaggery, and you can also give. And try to include carrot juice in their daily food, which will help to improve the gastrointestinal health also. And butter, sugar, and honey, a combination of this can help to improve the acidity also. You can just add the butter, sugar, and honey in a small katori, and keep the mixture ready. You can just give maybe quarter teaspoon or half teaspoon every half an hour. That helps to improve the severe acidity. Even adults can try this very simple remedy. Next slide. Irritable bowel syndrome, that is like as soon as they eat food, they have a tendency to visit the washroom, even though they have something to exit out or nothing, but they will always have a tendency, that is a crumbling sensation in the stomach. In that case, you can try the seed of the mangoes, like inside the mango there is a kernel of that mango, just powder it, because that is something which we throw it out after eating mango. So just preserve that seed, mango seed powder, and you can add little bit of water or honey to that, and when you administer it internally, that can help to improve the irritable bowel syndrome. We have a preparation called Dadimastaka Churnam, which is just made with the skin of the pomegranate, and it is very effective in the cases of irritable bowel syndrome. So from now, if you just throw out the rind of those pomegranate, just try to dry it and powder it, fine powder it. And whenever you have a stomach upset, just mix it with honey and you can have it. That's a very good remedy. And you can equally try arrowroot powder, which is just like that jowar. You can make kanji out of that. That's a very light food a child can digest. That helps to immediately stop the irritable bowel syndrome. And the vilva fruit, the bale fruit also, when it is there's a particular season for the bale fruit, you can preserve the pulp with little jaggery or with little chili pepper or something like that. This is a very good medicine for the irritable bowel syndrome also. You can just take it like a jam. Next slide. And sometimes with excess heat, the child may start having an anal bleeding. In that case, just fry the jeeraka churna with little honey, and you can add it with little honey and the ghee. That helps to immediately stop the anal bleeding. And also when they have the constipation, because that is again a very common complaint due to very less intake of the fiber food, you can the children end up getting constipation. So this is like that masikai, jadika is there, no? That you can make it as a paste and you can internally administer. That helps to relieve the constipation. And also the seed and the pulp and the root of the cucumber, when it is just applied on to the umbilical region, that helps to relieve the excess what to say, that the storage of the urine, that is very that the child can pass the urine very easily when there is a blockage of the urine also. And when there is an inflammation of the umbilical cord, so because as soon as a child is born, we just cut the placental remainings, and it is just weaned off from the mother's connection. So sometimes there may be an inflammation of the umbilical cord also. In that case, you can grind the Bermuda grass leaf, which make it as a paste and fry it with the ghee and apply it on the area of the umbilical cord, which can equally help to improve the infections around the umbilical cord. Next slide. And we also equally get to know the complaints like they vomit the breast milk immediately after feeding. So in the feeding, in that case, what you do is simply apply the paste with grinding little jeera to the nipple of the mother. And when the child feeds from that breast, automatically it becomes like a digestive agent. You have to use a very fine powder. And also children suffer with lot of mouth ulcers and all. In that case, you can try a special combination like the coconut fruit. We do get the coconut fruit, right? So we see falling of this immature coconut fruit lot in the coconut farms and all. So just collect it and remove the upper portion of that and apply it over the mouth ulcers. That can equally help. That is called Machinga Rasa in Ayurveda. That helps to immediately relieve the mouth ulcers. Next slide. And in case of constipation, you can add sesame seeds, poppy seeds, and flax seeds also. Castor oil you can use. Warm milk with light ghee. You can equally give 4 to 5 soaked raisins early in the morning. And you can equally apply asafoetida, the hing, just around their umbilicus to relieve the gas issues. Mix a little flaxseed powder with yogurt. Or you can administer amla juice, oat bran, and make sure that they are hydrated very well to relieve the constipation. Next slide. And unstable sleep, because this is also a very common complaint among children. You have to oil their scalp on a very regular basis. So you can use whatever seasonal oils like coconut oil, sesame oil, olive oil, whatever it may be, but that oiling of the scalp is a must. And you can try a little bit of ashwagandha and almond milk in the night, hibiscus tea, and there is a drug called Jatamansi that is a very good sedative, but not for the children, but you can give them the infused water of that and try to lessen their screen timing also, at least 1 hour before they go to sleep. Next slide. And nowadays we come across many of the eye issues related with the children. So they have a very blurred vision or a long vision or a short vision. In that case, that the triphala is very good for the eye health. You can make them to have triphala powder with honey on a daily basis, or we have a preparation called triphala ghritam, which can be taken internally to improve the eye health also. Other than that, this haritaki, that is the harad's seed is there, no? We have to just burn it and remove the ash of that and make it as a collyrium, either mixed with the ghee, honey, or the breast milk. And when we apply it around the eyes, that can help to improve the corneal opacity of the child. Next slide. And also there are certain foods which help to improve the eye issues. Try to incorporate carrot, red peppers, broccoli, strawberries, sweet potatoes, spinach, citric fruits, almonds, fennel, mishri, and raisins, fig, and amla. Of course, amla is very much needed as a daily usage, and ghee. Ghee is very much needed also. Next slide. And some of the drugs which can help to improve the memory or intellectual health of the child, Brahmi. We all know about Brahmi. And that Mandukaparni is a form of that. Ashwagandha, Vacha, and Shankapushpi. Next slide. There are certain herbal preparations which includes the above said drugs, like Brahmi, Grita. These are all Ayurvedic medications which can be given to the child to improve their memory and to improve their IQ also. Kalyanaka Gritam, Panchagavya Gritam, Saraswatarishtam, Brahma Rasayanam, Ashwagandharishtam. They are used in various other clinical conditions also. But in cases of ADHD, autism, Down syndrome also we can use. But basic action is to improve their intellect and the social behaviors. Next slide. And these are all called rejuvenatory drugs, especially tulasi, licorice, shatavari, amlaki, and bringaraja. That is that Eclipta alba. These are all called as rasayana drug, which can improve their immunity also. Next slide. So, and also many of us see children coming with anemic condition. Their eyes look pale and they are very pale to look, and that color will be completely different compared to the other children. In that case, try to have beetroot and apple juice on a daily basis and give them sesame ball or just sesame seeds with little honey, and include dates, tomatoes, grapes, pig, spinach, and moringa leaves, either in the form of a palya or in the form of a soup you can give, and make them to have a spoon of ghee on their empty stomach, And fenugreek seeds, fenugreek leaf also can be given to them on a daily basis. And amla juice with little honey also you can give to tackle the anemic problem. Next slide. Osteo health, that is equally important because they play around and they need more of energy. In that case, you can use that pirandai. Pirandai is the Tamil form of name of Asti Shringala. In Telugu, it is called Nalleru. You can make some dishes, soup also out of that. And try to include turmeric, drumstick leaves, sesame, neem, Krishna Jiraka, pomegranate, ginger, ashwagandha in their daily routine. So this can help them to tackle any type of bone pain and also equally makes them to feel more stronger. Next slide. Hair fall and lice problem. So in that case, weekly 1 or 2 days, just try to rinse it with little onion juice. And we know the sitafal, right? The custard apple. Save the seeds from that after taking the fruit pulp. Just wash it and dry it under the sun. Make the powder of that, and whenever you give a head bath to your child, just mix this seed in water and give a very gentle massage to the scalp. That's a very good remedy for the lice complaint. And you can equally give juice of the garlic also, because that enhances the hair growth. And some essential oils also you can use, like rosemary oil and olive oil also. Next slide. And jaundice, these are all some clinical conditions, but this needs and medical intervention. But only once when you make sure that it is a confirmed case of a jaundice, you can use these things as a precautionary agent. One is the radish leaves and water, boiled with the water. You can try it, very good remedy for the jaundice. And sugar cane juice, it can equally help in that case. Neem leaves with jaggery, and amla, tulsi leaf and ginger. And also the paste of the papaya leaves and to be taken with the honey is a very good remedy for the jaundice. Next slide. You can equally give barley water, amla and goat's milk. In cases of the jaundice, goat's milk is very much helpful compared to the cow's milk also. You can equally add tulsi juice, aloe vera juice with dry ginger for about 10 days. When you have it in the empty stomach with little bit of black salt, the jaundice can automatically come down. And if the child is cooperating, you can give the juice of the bitter gourd also. And turmeric amla is a very good remedy for, you can equally give the juices on a daily basis. Also, some fried cumin and powdered added to with the buttermilk can equally hydrate them. Next slide. And radish leaves, as I told you, you can boil it with the water. And there is a drug called giloy, that is the guduchi. You can have it along with the sugar cane also. And triphala powder with honey can help for the jaundice. And roasted chickpea, which can improve their appetite in case of jaundice. Lemon juice with little sharkara can also equally help to improve the liver function also. Next slide. In case of asthma, the breathing issues, you can again give amla. That is where I insisted the importance of Chavanaprasham, because that is like an Sarvaroga Nivarini. Amla is a very essential drug for each and every child. So even in case of asthma, you can try this boiled amla, grapes, ginger, just add little honey. Maybe you can try 3 to 4 grams every day. And you can equally take decoctions of black pepper, shunti and clove every now and then, which can help to relieve the asthma. Paste of black grapes, dates and long pepper, licorice and honey is a very good combination too. You can boil little milk with garlic, which can help to improve their respiratory health. And Vamshalochana, the bamboo seeds with Vasa Swarasam can also help. Long pepper powder with honey to be taken every now and then can help to improve their breathing issues. Next slide. Chicken pox, again, it's very common nowadays. and there are lot of red marks which is left over after, even though the incubation period is over. So in that case, you can use turmeric, licorice powder, neem paste, and there is a medicine called Shatadota Ghritam in Ayurveda, which can eradicate even the left out marks also. And Rakta Chandana, red sandal paste, you can apply on the marks. And body lotion prepared with Brahmi, mehendi leaves, and neem can be applied over the scar to remove it completely. And green peas, which is just boiled, application of the green peas boiled with water can eradicate the red marks left over after the chicken pox. Next slide, ma'am. And bedwetting is a very common complaint among many of the children. So in that case, you can give a small piece of cinnamon bark just to chew before they go to bed. Or you can add little warm milk with jaggery. You can make it as an habit so that they drink warm milk with jaggery. You can even try amla powder with little black pepper and warm water. These things you can give it just before they go to bed. Nutmeg powder, that jadikai powder, you can add maybe 1 or 2 pinches in lukewarm milk, because that's a very good sedative and it can have a very good bladder control also. 2 walnuts and raisins can be given on a daily basis to improve, that is like to control the bladder. And sugar with banana and amla juice, which is just made it as a paste and given on a daily basis, can improve the bedwetting. Next slide. Coriander seeds, until it just gets brown, just fry it. And you can add a little yellow with pomegranate flower. If it is available, you can add it with little crystal sugar and give it as a paste to your child, which can help to improve their bladder control. And mustard seed with cup of milk can also be given. Cranberry juice is very effective in bedwetting. And fennel seed, fennel tea you can give. So that also have a very good bladder control. Next slide. Deworming. Deworming, again, it's a very common thing what many parents just ask for. So you can give them papaya seeds with water or milk on an empty stomach. And the second remedy is just to give them coconut, grated coconut, just like that, let them take. That helps as a periodical deworming. And you can even try pumpkin seeds with little honey on a periodical way, maybe once in 15 days, like that. And a little bit of turmeric with buttermilk, you can help them to get rid of their worms, because these can be done. They are not very heavy laxatives, and the child also won't have any distaste towards these medications, because they are all very commonly used and on a daily incorporating remedies also. Next slide. And to be little bit more as a medicinal wise, a pomegranate bark mixed with water and just boiled, and make it evaporated and just constrict it to maybe quarter glass and give it every now and then, which helps us in deworming. You can equally, in case if you don't find the pomegranate bark or anything like that, you can equally give pomegranate juice on a very regular basis, which helps like a deworming. Next slide. Carom seed, that is the ajwain seed with neem leaf. It is very good, effective remedy. Every 15 days, you can just ensure. We also have a habit of taking it during the full moon day or a new moon day, because that is the count where we just have a count that every 1 month, once in a month, like that, we get our child's stomach dewormed. You can equally add hing, asafoetida, with little bit of warm water. Maybe for a week you can try. Nutmeg powder with honey also is equally effective in deworming. So I think this is all for the day, and I really thank for your patience listening. If any further queries, you can just mail it to me. And I think there are few questions here. If you can just turn on the question, I can try to answer it.
That was very interesting, talk, ma'am.
Yeah,
You have
thank
given
you.
remedies for almost all of the health issues of children.
Thank
So before we start the Q&A, I would like to start a small poll. So I would like the team to launch the poll. So I would like to request the audience to take 30 seconds to answer this poll. The purpose of the poll is to help us understand you a little better so that we can curate the topics better. And you can also let us know how you got to know about this WishwaTalk in the chat box. And let us know if you are a WishwaTalk subscriber or heard it through your friends, family, or you found it in the social media. So while you take the survey, I would like to express my gratitude to everyone who has joined us today and with your presence and interactive contribution to make this webinar a success. I extend my gratitude to our respected speaker, Ms. Tara Jayasri, for taking time to grace the event and to all the participants who have joined. And I would like to appreciate the Vishwa team who has made it a possibility to get this talk to all the audience. So now I would request our founder, Ms. Srivani Mullapudi, to initiate the Q&A. Over to you, ma'am.
Namaste, Tara ji.
Yeah, ma'am.
Such a wonderful.
Namaste. Nice to see
It's
you.
so good to see you. I know. I'm so happy to have you.
Yeah, thank you, ma'am.
It was
My
so
pleasure.
wonderful.
Thank
It was
you.
so wonderful to hear you.
Thank you.
I'm a grandmother of 3, and I do give some remedies I used to give to my children, now to my grandchildren, but probably 1/100th of what you have suggested. It's like a treasure trove that you have just shared. It
Thank
is
you, ma'am.
something that mothers of this time is completely losing. And to hand it over to, I mean, at least to give an opportunity to the coming generation to listen from you, a Vaidya, about these issues that children will face and how mothers can take care of them, especially after COVID and the way the immunity has come down, being able to show a pathway. Young parents get bewildered, overwhelmed, and scared when they see that their children are suffering and they don't know what to do. And allopathy does give solutions, but when we have our own age-old wisdom to help our children in a very natural and organic way, it's like God's blessings and a grace, and that grace you have just shared with us. Thank you so much.
Thank you. It was a pleasure being in this team. Actually, it was a very good platform to expand, or just share my knowledge, whatever I got from my guru. So I think I have just tried to make it more simple so that everyone can follow from whatever is available in their home. Rather than there are different formulations of the medications, but if I explain that may need a medical advice, so these are some things which can be easily incorporated in the initial stages from our basic kitchen. So that was the main thing behind this thing, ma'am.
Yes, and the way you have simplified it, you've taken time, taken care in giving us scientific names to all the leaves or the trees or the barks that have been suggested. It was very a lot of effort you have put into make these slides and make it because pan India people across the country are coming to hear Vishwa talks, and instead of just giving names in Tamil, you have put in that extra effort so that everybody across the country can take that wisdom. Thank you so much about that.
Thank you, ma'am.
I
My
would like to
pleasure,
thank
yeah.
I would like to thank the audience. Such a wonderful audience we're getting in Vishwa Talks. Genuine people from across the country coming with genuine questions, engaging with our speakers, such that everybody across the country and sometimes even abroad are able to ask questions which are pertinent to everybody else. That is really becoming a huge network of support to each other. Thank you so much to the audience also. And a special thanks to WishwaTalks team, the effort you all are putting in, whether I'm there, whether I'm not there, impeccable professionalism. Thank you so much to the WishwaTalks team.
Thank you.
Yeah, I'll give our first question to Shmuel. Please unmute yourself. Yeah. Welcome,
Yeah.
Shmuel.
Welcome. Thank you. I am muted. Okay. I very like it, this presentation, this new subject for me, and I want to ask you next question. How exactly Ayurveda can support effective treatment in children with PTSD, children with post-traumatic situations.
Children with?
PTSD, post-traumatic situation.
Can you type it, please? Post?
Traumatic.
Traumatic, okay, post-trauma,
Traumatic.
physically.
Got it.
But that can be managed in case, for example, if there is any physical injury, that has to be managed in an Western way only, sir. Because, for example, in a case of a cerebral palsy, we do have a lot of inpatient treatments. Like we have some special rice boiled with little milk, and we make the patient to get admitted for that, maybe for a week time or 10 days. Because Ayurveda can help to strengthen the muscles and also the ligaments. So in case of some other trauma, like they had a very heavy fall from a very height or anything like that, resulting in a contusion or anything, we do have certain oil applications and certain poultices which will help to immediately relieve the pain. In case of any fractures and all, we have to intervene surgically or with any other staples or plasters. But there are certain medicines to improve the osteo health also, which I have just discussed, especially the herb called Astrishringala, that is quadrangularis, even almonds, sesame, which are very good in calcium, has to be incorporated on a daily basis to improve the bone health.
Shmuel, you should visit Ayurveda Chikitsalaya, where Dr. G.K. Tara Jayasri actually practices as a Vaidya. Vaidya is a doctor. It's a wonderful place, and it's a research organization, and she does a lot of research, and her team does a lot of research. I have a lot of cousins in Coimbatore who tell me that people who have gone there once a year, when they are 60 years, since they are 60 years, and even if they're 90 years, they just look 60. So also, I heard some cousins tell me that friends of theirs who was a dancer who had an accident and her bones were completely broken. She couldn't even walk. After she was here at Ayurveda Chikitsalaya, now she's dancing, not just walking. So, yeah, I hope your answer about post-trauma is answered, or do you have any further query?
Yeah, of course. Thank you very much.
Yes.
Thank you.
Thank you. So, you have said about Upanayana. Is it some of these milestones, the milestones you suggested is relevant to everybody, but are these rituals like Upanayana and all with respect to only certain communities, or can anybody
It is
perform them?
followed only by certain communities, ma'am, now. But actually, the main thing is like the concept is the young person forms as a dvija, that is, he is twice born. They have made it more religious nowadays. And when we tie the thread around the waist, no, that is an indication whether they are growing taller or they are growing broader. So that is an indication that their nutrition wise is health is so measure to that's a way to measure their nutritional status.
Okay.
It
So
was
we in
meant
the
like that.
Telugu communities call it molatadu when we tie it around the waist.
Mhm.
So yeah, I always did it to my children and grandchildren, but I never knew why. Thank you for sharing it with me.
That was an ancient way because we never had measuring tapes or anything like that. Anything which helps to measure their height and all. So this was specially made by the acharyas. Like when we tell it in the name of a ritual or anything, people have a fear to follow that. Anything given in the name of the god, they will definitely follow that. That was the ideology behind that. Like that.
Dr. Shadiq Siddiqui has a question. Need to know about Swarna Prashna.
Yeah, Swarna Prashna, actually, we do it in every Pushya Nakshatra, ma'am. That is mainly to improve the immunity of the child, actually. We have a combination of Brahmi, gold, ghee, and vacha. That is the main ingredient of that. And we have to mix it for a few hours so that it becomes a very good amalgamation. And we give it like until 16 years of the age, which is a very simple mechanism to improve the immunity of the child.
Is it given only on that particular day?
Only on that particular nakshatra. Even certain things we have to follow. Even the mixing has to be done in certain nakshatras only.
So when you see nakshatra, is it the nakshatra of the child?
No. It's
look,
like a Pushya nakshatra, the regular nakshatra.
When the calendar is on a certain date.
Yeah. Not the star of the child. Right.
So anybody can take this particular concoction on that day.
Yeah, they can take. Until the age of 16, they can take.
From which age should they be taking this?
Right from the birth, they can take.
Okay.
Yeah.
There is a question from Ms. From Suravi Rathod Rai Gandhi. If we don't eat honey, ginger, and garlic, then what are the options?
Religiously, there may be some restrictions in following honey, ginger, or garlic. They can use hing because according to Ayurveda, garlic and this one shallots, onion, are considered as tamasic. Because I think you know the mythological story behind garlic and onion. When there was a churning of the Milky Ocean, Asura took away the pot of Amrita. And when Raghu and Ketu were sharing among themselves to drink the Amrita, Vishnu chopped Raghu's head. And when the blood was about to fall onto the ground, no, that grew as an garlic and onion. So even though they have medicinal qualities, we don't encourage too much use of garlic and onion according to Ayurveda because they have properties of devas but qualities of asura. That is why even traditionally they don't follow much of garlic and onion even in certain communities nowadays. Even from the beginning it was like that. But those who are having too much of pitta prakriti, too much heat in the body, those who have premature graying of the hair, eye issues, the burning issues and all, we don't use garlic. So they have made it as a religious thing also to not to use garlic and onion in many of the families, especially Jains also. In that case, you can use hing, asafoetida, that is equally effective. And instead of honey, you can use ghee also, but not in an equal quantity. Ghee can be incorporated on a very regular basis.
Regular meaning smaller quantities.
Yeah.
Okay. How are garlic drops? How do we make them?
Yeah, what you have to do is slightly warm the oil from the spoon, maybe half teaspoon of that coconut oil, dry coconut oil. Crush 1 or 2 garlics and extract the juice out of that. and mix it with the warm coconut oil and try to instill it with your ears or a dropper inside the ear. That release your wax and even the ear pain.
Next question from Anjali is, when a baby is born, we can give Suvarna Prashna directly or ghee honey dipped in gold?
The first thing is ghee honey dipped in gold. Swarna Prashnam can be given in the specific nakshatra, Pushya nakshatra.
When you say ghee and honey dipped in gold to be given to a baby, is it just a drop?
Yeah, just a lick it. Just
Is it just a drop?
Yeah, just a drop. That is more than enough.
Of late, a lot of doctors I have been hearing where they say we should not put oil in the ear. But when you are suggesting us to put 1 or 2 drops, what is your opinion on that?
When there is a pus discharge, we also don't agree, ma'am. But when it is a filling of a ear, wax, or any infections from the sinusitis, they can use it actually.
Okay.
When there is a pus exudation, it is better not to use.
Okay. This is from Jiti Ashish. Please, can you help me with my kids? They have frequent cough and cold. Coughing very soon becomes purulent without fever.
Yeah, you have to start giving them a little bit of pepper, the spiced honey, as I mentioned. You can spice it with clove, cinnamon, pepper, ginger, or tulsi, lemon, any of this. Make it as a regular basis. And once when their congestion is over, you just strengthen the lungs with daily usage of Chyavanprasham. That can help to keep it more preventive, so that they don't get affected in a very frequent way.
When my daughter was a baby, for a whole year, she had cold. We used to give antibiotics. It would come down and again it would repeat. So after 1 year, what I did was I started giving her a concoction of tulsi, ginger, and honey. Tulsi, I would just press it out of the leaves. Ginger, I would grate it and heat it with water. And honey, in equal 1 teaspoon, I would mix, put it in a box, give them just a couple of drops of it, and it never repeated. And now for my grandchildren, they live in apartments.
Remedy. Everything available in our garden, but we don't know the use of that actually. So that's a Chyavanprasham is a combination of everything. That if we find it difficult in doing it on a daily basis, just get the jam out of that.
Which where do you suggest this Chyavanprash? Which brand would you advise us to take?
Brand, instead of going in for a brand, taste it and see, ma'am, that taste of that Nellika should be there, Amla should be there, it should be sour. Many of the companies just it tastes very sweet, but that is not the original quality. The first taste should be sour. In that case, that has a genuine quality of Chyavanprasham.
Another thing I used to do for cold is I used to take the neem leaves and boil them in water and put pinch of turmeric after the boiling is over, and then give the steam to the kids. If I find the cold a little strong, I would do that. That also helps early in the morning at 6 a.m. and 4 p.m. in the evening. If you give, that also helps a lot.
Yeah,
so next question
that
is,
acts like an antibacterial, because any infection through the nasal passage, neem helps like an antibacterial, and turmeric obviously an anti-inflammatory also. Like that.
There's another question: how to increase weight for kids?
Weight wise, you can try that boiled Nendra banana. Kerala banana you have seen, no? Nendra, that's a variety of banana. You can try giving that banana on a daily basis. That can help to improve the weight of the baby. And try some oil applications which I mentioned earlier, that Balashwagandhadi Thailam. Those things helps to improve the weight of the child also. And if they are okay with, you can give porridge out of Navara rice. That is a special type of Kerala rice which is harvested in 60 days. That is very good in calcium also. You can make a plain kanji out of that, and that helps to improve your weight immediately.
Another thing that I would practice with my children is 6:37 in the morning. I would have them do karate, and that actually this exercise would improve their appetite and no issues, no complaining about having food once they did their karates in the morning.
Okay.
So next question, Koman Bale. Can we give Suvarna Prashan on daily basis from birth?
No, ma'am. Daily it is not advisable. Only on the certain stars we give. That Pushya Nakshatra alone, once in a month we give.
Is there an alternative to Swarna Prash?
Alternate, you can give Brahmi Gritam, you can give, but it won't be an exact alternate of that. Saraswata Gritam you can give, Brahmi Gritam, that can be given on a daily basis.
This is from Shweta Jain. Ma'am, 7-year के kid में constipation के लिए क्या better remedy होगा?
Yeah, you can give a little bit of castor oil, maybe 1 spoon with warm milk at bedtime. Or even you can soak a few raisins, black raisins on a regular basis, maybe 10 to 15. Crush it along with the water, and you can give it on the empty stomach. That helps to relieve the constipation immediately. The child won't restrict taking that because of the taste. It can help also.
This is from Dr. M. Pichai Al Punami. For baby who are allergic to milk, breast milk, what remedy can be given?
Goat's milk can be given. Goat's milk is equally effective like cow's milk. You can dilute it with water and you can give it.
This is from Ms. Manisha Zamis. Someone's kids complains of tiredness or lack of energy. What are the better remedies to overcome this?
You have to give them, start giving them dry fruits. Instead of going in for any processed food, make some dry fruit laddus mixed with sesame seeds, almonds, pistas, and other thing. You can equally grind it with dates and give them 1 or 2 balls on a daily basis. You can equally give them sesame balls on a daily basis. Ellurundai. That helps to improve their general energy levels also.
I'll just take a 2 minutes break in the question answers. I'll just talk about the upcoming talks. There is one talk coming on education from Dr. A. Ashok. He's an IAS retired CEO and director of CHSS, Center for Human Security Studies. The topic is on transforming healthcare, impact of AI. We have our next talk on art and culture, untold story of the forgotten hero, Kanoji, the Navy Admiral. The speaker is Sohail Reiki. He's the author of the book, Angria. This talk is on 10th February, 2024, 11 a.m. Looking forward to having all of you back. And I would, since of late, the Instagram and Facebook and WhatsApp or even emails have been restricted a lot. So the only way WishwaTalks can move forward is through word of mouth. And my request is anybody who gets a message about our talks, please share it with your friends and family who you feel can benefit out of it. Okay, I'll come back to our next question from Ms. Vishaka Avari. Hello, ma'am. What can be the treatment for 2.5-year-old child complaining of slightly hard stool along with mucus and urge of passing stool 2 to 3 times a day, sometimes soon after meal? What can be given in such conditions?
Yeah, in that condition, you can try this arrowroot kanji, ma'am. Or even jawar kanji can help. Keep the digestion as light as possible. You can't load it with anything which is very spicy and oily. You can try Vilvadi Lehyam. There is a medicine called Vilvadi Lehyam in Ayurveda. Maybe half of teaspoon every like before every meal you can give, once or twice a day you can give. So that can help to improve the absorption more than the constipation or a mucus discharge. That helps to improve the absorption so that the bowels get into a regular habit.
The next question is from Mr. Dr. Syed Nishad Ahmad. There's a lot of acknowledgements. From him, it's about thanks a lot, and really very thankful to WishwaTalks for arranging this webinar. It's Dr. M. Pichai. It's really useful, ma'am, and thanks to WishwaTalks, Mr. Rakesh Mahendra. A lot of acknowledgements in between. I'm too many to read out. There is one question here. Today, the main problem is junk food and packed curd, milk, ghee, etc. How to change kids' lifestyle? What can we give them?
You have to select something which is naturally available. Junk foods, everyone included in the family has to avoid taking, because it's like one person takes it and the other person gets really tempted. So in that case, you have to convert it into some natural food, things like ragi balls, ragi drinks, and these peanut balls. Even now, the school is not allowing the chocolates to distribute in the birthday functions or anything like that. So they equally ask you to bring any other peanut chickies like that. So in that case, you have to replace. It has to be a firm decision from the parents.
That's really nice that schools are promoting things like this. Another question from Mauli Karmakar. How bale fruit should be taken for IBS?
Yeah, we have a medicine called Vilvadi Lehyam, in which the main ingredient is bale fruit. You can get it in that ready-made form, or it is a seasonal fruit. So when you have when you get a chance for a ripened bale, to get a ripened bale, just to scrape the fleshy portion of that. You can preserve it with little jaggery, and you can use it whenever needed.
This is to Miss Usha's question about the address and the name of the Ayurvedic center. It's Arya Vaidya Chikitsalaya. It's at Coimbatore. You can go online. It's available on the website. The address is available. We'll also post it in the chat box. Radhika, please take care of it. This is from Sharmi. Can you please explain how to prepare bath powder for baby girls?
Baby girls, mainly you include oats in that, and if possible rose petals, and a few dry rings of orange peels, and soap nut powder you can use, and little bit of that shikakai also you can use. So that helps us in lathering effect, and equally helps like a scrubber also. Along with that, rose petal can take care of any skin allergies or anything like that.
And for those of you who don't have the energy to prepare it, ma'am Taraji has made a beautiful powder, Sunipindi. You should take it. You should take it from the Ayurvedic Chikitsalaya. It's really good. Ms. Visha, would you like to ask?
Ma'am. Thank you.
Yeah. Would you like to ask your question?
Yeah, namaste to everyone. I have a question which is not related to the medicines as such. My question is related to Ayurveda itself as a whole. I don't have much information about Ayurveda as such, and my little bits I have, which I understood, has come from listening to certain podcasts like this. So my question is, actually, I have two. One is, how do you, how do you get the younger generation to start accepting Ayurveda, or gravitating towards the understanding and the philosophy of Ayurveda? And from my limited understanding, I understand that it is also the way you live your life, how you navigate through your life on a daily basis, not just in your physical activity, your mental, your all. Like when they say yoga is a union of all three, Ayurveda also, correct me if I'm wrong, is also a prescription to navigate through life in a most organic, balanced way that is, um, you know, very nature-centric way. So my question is, how do you bring the younger generation to look at Ayurveda, to open their eyes to Ayurveda in a holistic way? That's my first question.
Yes, ma'am. That's quite challenging, but it is from each and every parent has to take it as a measure, because once like maybe in a family one is following a pure and natural way or any organic thing, obviously the every thing has to be followed in that way. Only by that we can inculcate Ayurveda for the next generation. For example, if we start taking an antibiotic for each and every cold, next time when even the child is about to get a cold, it is very obvious that you start an antibiotic maybe by your own or even without any prescription from the doctor. We know, because everything is available online. So it is not anything which is very surprising to take an amoxicillin or any Pantodac immediately once you get a viral infection. We don't even know whether it is a viral or just a very simple rise of temperature or anything. But nowadays, since everything is available online, it is both an advantage and a disadvantage also. But when you start trying such home remedies, no matter it's an Ayurveda, Siddha, homeopathy, or any natural therapy, it equally helps to improve their immunity. At the same time, it helps to level also, because they can be mentally prepared. Okay, it will take some time to get into that. Being an adult, when we admit the response from the medications, the child's health is designed in that way that the absorption is very soon. Especially when we are able to diagnose it in the early stages, we can straight away get the disease under control. For example, I can state one simple example. When a child gets a fever, fever is the maybe an later stage of a cold or congestion. Once when it just starts taking getting a throat infection or an increased lacrimization in the eyes, you get to know that the child is going to get affected with a cold or cough or even a fever. So immediately start some home remedies. Let it be a very simple ginger juice, honey, or a spiced pepper. So one thing, the child gets to know the importance. Second, it gets mentally prepared, and so that it doesn't get exposed to any unwanted antibiotic or any injections like that. So that is the only way. If everyone in the family follows that, that can be definitely possible, I think. Number two, yoga. As you said, that's like a discipline. It is not any science or anything like that. It's a basic discipline of an individual. So when you dedicate your body and time to certain that too for your own well-being, that is an investment for your health. No, you are not doing it for anyone else. So it is just for your own health, and it brings your frame under control, your thought process under control. And after all, when you do it for your own self, your mind gets more determined, and you get to know about the advantage of many other things in the life also. For example, if you just decide to join a yoga class, nowadays we are not able to do because we don't have time to go out, we don't have time to spend for especially for the yoga. But once when you start getting the benefit of that, you automatically get into that. So that is basically
I can add a little bit here.
I
have 3 kids of the coming generation, and I have brought up my children without medicines, mostly with home remedies. My daughter, with her 3 sons, just pops Allegra at the top of her hat, a Tylenol at the top of her hat. So when you asked me, how do we get this generation to actually come back to our age-old wisdom?
Yeah, that's my actual question. Yeah.
So what happened was, they don't even come to my WishwaTalks. They don't even watch them. But what I have done there is, I may not be able to give this opportunity to my children because they don't want to take it. But there are hundreds who are visiting WishwaTalks every day, every Saturday. And somewhere they might share it with their friends, family, children. So that's my way of contributing. But what I've noticed with my daughters is I've seen them since 8, 10 years going to college, streaking their hair, burning their hair, uh, blow drying their hair, you name it. And then now they come back and say, Mom, hair is falling away. Please send the homemade oil. We want to put it regular. And
Yes.
then my elder daughter says, I have a ritual of having a body massage and a nalugu every week, both for my hair and body. And then now my daughter, who's probably 28 years, is saying, I want to follow this routine because I see your skin is different from your own siblings, your own people of your own age group. And she was heavily into Korean products, checked everything under the sky. At the drop of a hat, a function is happening or a wedding is happening, she'll go and do something to her skin, especially with so many skin treatments coming out. But slowly, when they see what is happening around them, then they come back. This is
Mm.
the beauty side of it,
Mm.
the beauty care side of it. Now I have
Correct.
another daughter who got skin rashes, and they see it on their skin. And being youngsters, they want to look pretty, they want to look lovely. And then what they notice is it's not working. They've used chemicals for a few years and it's not working. So now my younger daughter has started gut cleansing since 10 days. And she's saying, I'm taking this, and she doesn't want me to guide her. She's not taking my guidance, she's taking another expert's guidance. And now she says, Mom, there's not a single food available in the US where I can say this is pure. Everything is processed. Everything is processed. And I look back, it's the Indian food which I can have with ease and grace.
Mm.
I have my own annam, papucharu, or koral, palakorlo. She says, these are not processed, but anything I touch in the US is processed. She's studying out there.
Mm.
So now, after examining for themselves and seeing the impact on their own bodies, on their children, that is when they're coming back to our wisdom. But unfortunately, what is happening is the entire generation is living in apartments.
Mm.
So there
Yes,
is
I
no
agree.
accessibility to tulsi. There's no
Mm.
accessibility to neem leaves. So there has to be a demand from people. Yes, I may be living in an apartment, but in the garden down, I want a neem tree, I want a tulsi, I want these medicinal plants. Fortunately, in Hyderabad, there is a place called Pragati Resorts. And
Mm.
there is this man who has collected 1,000 varieties of plants and many medicinal plants. Now, if there is somebody who's interested, can go collect these plants, get it put in their, if they're living in row houses, in their community gardens. And slowly, if things like WishwaTalks, if we are able to bring in this awareness among different communities and
Right.
get a demand that we want to live our lifestyles in this way. See, WishwaTalks has come up for that reason, right? We
Mm.
want to bring back that culture which we had. Because, and that's
Mm.
the first step to do it is to bring in awareness. And that's why
Yes.
WishwaTalks is only sharing all this with you all. So that, when you see for yourself, yes, this is what is needed, at least with your friends, your circle of influence. Who's your circle of influence? Your immediate family, your friends, your community in which you're living, your workplace. So these are the places that this 80 people or 100 people who are visiting WishwaTalks every week, when they see value out of what is being taught, it is for them, if they wish to put this influence in their circles, that yes, we have to demand for this kind of a lifestyle. We should demand for the next generation to have access. Finally, yes, they want to do it, let them have access to non-processed food, let them have access to a tulsi or an amla or whatever. So this is where we have a role to play. Yeah, I hope this answers your question.
No, I agree. I mean, what your story resonates very much with me because I too have two boys, and they are very much adults. And certainly, my husband and I we practice, trying to be as close to nature as possible. It's a journey, you realize in that journey there are many biases, prejudices that you would have built up. And I think that is the social influence that has happened. Your education, everything has contributed to the bias and prejudices. So as we encounter, personally, as I encounter certain things, it's like revelation. Oh, now I know. And then that's the moment I drop, whatever it is, right? So I totally understand and empathize with you, because my boys don't listen to anything that we, this thing do as such. So, and I'm hoping that situation changes, and that more and more awareness and knowledge and understanding and pride in our ancient culture and tradition, because they were not mumbo jumbo, they were not regressive, they were in fact very advanced. That pride, I'm sure, will come in. And then only, I mean, when you have pride, only then you apply it, right? Because there's always, the youngsters have a choice. I want to exercise, let me run to the gym. Gym becomes the first option. Yoga is only when you've gone through a stage, you've burnt yourself, and there's no other option. Okay, then we come to yoga. Just like your children. Now my skin is so bad, my hair is falling. You've gone through that whole thing and no other option is working. Okay, now let me go to the home remedies. When you naturally gravitate to it, you would have prevented many of these things from happening. So let's hope that situation reverses. And my second question, which I had, was that I had listened to a podcast sometime back to another. That was another thing which I wanted to share. That during COVID time, there was a lady, an Ayurvedic Vaidyan herself, who had come out with a podcast on a weekly basis, and she had brought in many people. And that is how my little knowledge about Ayurveda and how what you would say came about, because of the series of talks that she had held. And I wanted to and then it came to me that it'd be so nice if the Ayurvedic fraternity were to collaborate to come out with little modules that is there on a virtual space in books and all of that, where the knowledge is dished out, just the basic knowledge, just enough to get people convinced. Okay, then I need to look at this, I need to apply this in my life. So in one of the podcasts, this lady was saying that the curriculum, the Ayurvedic curriculum, as in the ancient times, involved Jyotisha was a major part of the curriculum. Yoga was a major part of the curriculum. So I was curious to know, in today, under the Ayurvedic college, is Jyotisha a major curriculum that is there in all the 5 years? Is yoga a major curriculum that is there in all the 5 years? It's a major chunk of the learning that you acquired. Even this thing, I understand even Bharatanatyam help, because you come to know of the raga and rhythm of the world, the planet, and whole of life is vibrating in a rhythm. So knowledge of these things was what they were suggesting is an essential part of you becoming a Vaidyan with Siddhi, to recognize. They were Vaidyans like that. Just at a look, they knew what is off. And then they tell you, this is what you need to do to bring it back. So I'm just curious to know whether the Ayurvedic college has that curriculum like that.
Yeah, we have a curriculum for yoga, ma'am. That is a paper. We have to study all the asanas and other things and all. We have to pass that paper also. In the first year, we have yoga as a main subject. Jyotisha, actually the basics we have to learn, but it is not like for the whole of the curriculum. But for example, like when we deal with certain cases of skin complaints and all, we believe that it could be due to the Sarpa dosha also. So in that case, rather than merely advising the medications or prescribing the medications, we ask the patient to rectify it astrologically and then start with the medicines. We have very evident case which have got completely cured from the ailment after doing the Ayurvedic treatments. Just prior to that, they have rectified all the doshas from their stars, and then they have done the treatments, which proved very efficient, because in that case, we can 100% confirm that Jyotisha is a part of Ayurveda. And
Correct,
we do have, it's basically the interest, and number, it's not a compulsion. Number two, each and every Ayurvedic physician is given a basic knowledge about Jyotisha, at least to do certain treatments. For example, when we undergo an intensive treatment like Shirodhara and Pilichil and all, there are certain stars where we should not start, and there are certain auspicious stars where we can start the treatment. Even to start a mild oil application or to get admitted to the hospital, there are certain people who see according to the time and the stars, and then they get treated. In my personal experience, I have seen many cases from my guru, Dr. Ravindran, who has been very successfully got relief after rectifying their doshas and then undergoing the treatments also.
Correct, yeah.
Yeah.
Thank you, doctor. That was one information I needed to know.
Yeah.
Because I'm hoping that as we move forward, Ayurveda, all our Indian Shastras, right? The content becomes more deep and more meaningful, because the spiritual aspect of all of this, which has been cut off due to the way education system had come into it, if that is interwoven into the learning process, that your own daily spiritual sadhana is what helps you become better at whatever it is that you do. So I really hope that our Indian education system, in all of these shastras, that is also brought in to create, people with siddhis. Yeah. Thank you.
Thank you so much. Yeah. So the next question is from Mr. Nagarajan Krishnamurthy. Remedy for headache after headsha may be explained.
Yeah, in that case, the headache may be due to the excess water retention, or when we don't wipe off the head properly, there could be one of the water retention or sinus related headache. In that case, we have a medicine called Rasnadi Churnam, where we mix it with water and apply like a paste on the forehead, which can completely reduce your water retention. If you don't get Rasnadi Churnam, just keep a powder of dry ginger, and you can mix it with little milk or warm water and apply it like a paste on the forehead. That gives an immediate relief for your headache, resulting from the not wiping your hair properly after a head bath.
That's lovely. Dr. M. Pichai has a question. Child has continuous sneezing in the morning. What can we do to relieve that?
You can give a mixture of turmeric powder, ajwain seed, and jaggery. You can mix it with little, you put it in a pet jar, crush little bit of ajwain, maybe a little jaggery to make it sweeter, and take like maybe 5 grams on a daily basis after food. That's a very good remedy for any type of allergic sinusitis and rhinitis.
From Miss Anjali Amvani, applying kajal is applying kajal for newborn babies okay?
Newborn baby, we have to ensure about the ingredients of that, because actually anjanam is a process in our daily routine. We have to apply collyrium that acts like an eye cleanser, but we have to just make sure with what material it is made up of. Sometimes we make it with trifla churnam, sometimes with almond, and sometimes with the castor oil and all. So it should not irritate a newborn child. So ensure the medications behind that and you can use it.
Question from Ms. Chetna. Allopathic pediatrics denied use of honey and grita for 6 months of age. What's your opinion on Ayush Karma done at birth?
That is a Jata Karma is definitely has to be done for each and every child. I myself have done it for my child, and she was never less for any other thing. And till certain period, she was equally have taking all the media drugs and all. But now, due to the time constraint, she has stopped taking that. But we don't have any theory against that. But I have seen many intellectually bright children who have undergone this Jata Karma. So there is nothing against that actually. Actually, ghee is a blood-brain barrier. So even for certain age-old, like old age problems like Alzheimer's and forgetfulness, or even some nerve-related disorders like Parkinson's and all, we have many medications with ghee as the basic ingredient in that. So it can help to improve the neurons, obviously. So it can be given right from the number 1 day of the birth.
Okay, next question. Any remedy for stomach pain in children?
Stomach pain, we can give many other remedies like buttermilk and hing you can give. Pieces of dry ginger you can give. You can roast cumin or even ajwain seeds and just to put like boil it with water, filter it, and you can give every now and then.
Question from Dr. Dinesh. What do we do when children 4-5 years old do not eat anything or just eat like packets or only one roti or a small quantity and says she does not feel like eating, and this goes every day?
Yeah, you can try some medications like Ashtachurnam. It is a combination of 8 medicine in which we use salt as the main ingredient, ajwain, hing, and other all digestive herbs only. It's a very simplest form of medicine. You just have to, the procedure is you have to first mix the Ashtachurnam with the first bolus of hot rice with little ghee and give it to the your child. That improves their taste bud also. You can use any child of any age group can use this Ashtachurnam. Either with honey or ghee you can use it.
Can you please explain, this is from Ms. Sharmi, how to improve the immune system?
Immune system, this is Chavanaprasham is the best lehyam to improve that. If that is not available in your place, just give them amla juice on a daily basis.
This is from Ms. Suravi Rathod. Bal guti items to use, can we use them on a regular basis?
Which one, ma'am?
Bal guti.
I didn't get that. What?
Ma'am, would you like to come online and make your question with more clarity? I'll go to the next question. I bought a Bal Prashan from Baby Organo recently, and they have mentioned give it daily 1 to 2 drops as per age, or else give it on a specific day. What do you say?
Yeah, I need to know the ingredient of that. If it is similar to the Swarna Prashanam, you have to give it only on the particular stars. It is not advised because it contains Swarna Basma, which is not advised on a regular basis. If Swarna Basma is not there, other drugs like Brahmi, other Vacha is there, you can give it on a daily basis. But Swarnam is not advised on a daily basis.
What can be the treatment for 2.5-year-old child complaining of slightly hard stool along with mucus and urge of passing stools 2 to 3 times a day, sometimes soon after? What can be given in such conditions? Did we answer this?
Yeah, you can try one medicine in Ayurveda called Mustarishtam and even Jeerakadya Arishtam you can try. That is a very simple Arishtam. The main ingredient is the cumin seed. Maybe 2.5 years you can give 5 ml after food. Mustarishtam, and if you don't get that, you can try Jeerakadya Arishtam. That helps to improve their appetite and absorption.
This question is from Mr. Nagarajan Krishnamurthy. Why is it that we do not include this subject basically in high schools and colleges as life-saving and life-leading skills?
There are some plans to incorporate this, sir. Even higher secondaries will have Ayurveda subjects in future. Some decisions are going on. It will be soon implemented.
Yeah. Should Chamandraspas be taken first thing in the morning or on an empty stomach?
No, preferably after breakfast.
Bal guti, basically some kind of spices like harda, jalfal, maufal, jetmad, etc. used to rub on a stone and give it to small babies.
Yeah, usually jati fal, masi fal and all you can give. Just wipe it off with in the sandal wood grinding stone, and you can put it in. Usually we do it in the sandhis, all the joints. Just as a Rakshogna effect, we can give it. If the child has any sleep issues, you can use that nutmeg powder, jati fal powder.
Okay, with this, I will close the session. Thank you so much. There were too many questions today and you have so patiently answered them. Thanks to you, Dr. Vaidya Tara ji, and to all the participants for engaging in this session. Genuinely, thank you so much.
Thank you, ma'am. Thank you for the opportunity also. And I'd like to be connected with much more other topics also in the further forthcoming sessions. Then. Thank you.
Definitely, we'll do
Thank
that.
you.
We'll
Thank
do that. I'm so happy that we touched on this topic this time. Last time you spoke about women,
Yeah.
so useful. Now you've spoken about this. We'll come with many more such topics.
Sure.
Thank you.
Thank you. Yeah.